Hello, everybody, and welcome back to Politics Relaxed. It's a new year, and we're back as always. Hopefully, lots of new good content coming again in 2023, as always. Today we're going to talk about the NHS. It's been in the headlines for the last few weeks. Nurses are on strike currently. Junior doctors looking to join them possibly, and there's just this mounting pressure on the NHS. Waiting lines are up. People can't get ambulances, and it just seems like such a big issue. So that's what we're going to talk about today. Let's get started. I guess maybe start on this issue of pay because that's what's been talked about at the minute. I mean, the Royal College of Nurses already on strike. Junior doctors set to join them.
Yeah, right. Well, look, the pay issue is something that we're experiencing with across the public sector, and it all roots back to the pay freezing under austerity, which uh, you could argue for back then, considering the situation, but now they did the pay certainly needs to be updated, and well, it hasn't been. Um, for various reasons, and well, now they're choosing now to express that they that they want higher pay, and well, that's what the strikes are all about, isn't it? The nurses are striking for the first time ever, which and yeah, it doesn't seem that negotiations are going particularly well because the conservative government, like their policy towards unions is sort of just like ignore them, which you know it's not working out particularly well. And I think there could be a more proactive negotiation approach to be made, especially with the NHS, which is so vital a service for so many people.
Yeah, I mean this has come from austerity, and it's come from David Cameron freezing the pay of public sector workers for so long. And I mean this was such a wasted opportunity for consecutive Conservative governments, which have we've been in a situation economically which has meant that we could give a pay rise to nurses, to doctors, to anybody working in the NHS. And even now, it would only cost the government 10 billion, which sounds like quite a lot. But for the amount of nurses and doctors that we're going to lose from general unhappiness, from the pressure, in my opinion, it's more than worth it. Especially considering what we were paying for PPE that never got used, for a test and trace app that's got used for about a year. If you look at those eye-watering sums, 10 billion doesn't sound like that much compared. I'm just so worried. I mean, I've been talking about the NHS for years, and how under pressure doctors are, how under pressure nurses are, and how bad their situation is. And it only now seems like the press have picked up on it, people have picked up on it, and now this is breaking point for the NHS, I think. And it's so vital that we keep the nurses and we keep the doctors that we have currently working in the NHS, because we've already lost so many, and we haven't been recruiting them at the speed that we needed to.
Right. What I find is interesting about the NHS and its and the strike and the action that's happening in our current times, that with the NHS it's often a victim of its own success. So the real question is for Sunak's government or Labour governments going forward is how to deal with the NHS going into the future and how we're going to reform it so that we don't see strike action like this again. Because what's happened is that the NHS is often a victim of its own success in the sense that as it grows bigger and bigger and as people's life expectancy increases, the cost of running it and the cost of the upkeep and paying it and maintaining it is going to increase and increase. And the deadlock that we're having now and the issue that we're having with pay is a situation that's only going to continue to get worse if there's not actually a concrete policy to fix it. But the only issue that I can see really is I can't see a way forward out of this current strike action. I think if I got my statistics right, the percentage of the pay was 17%. Now, obviously, we can understand the context of that in the 12 years of underfunding the NHS. In real terms, it's not a large pay rise, but I struggle to imagine how that's going to convince the general public, how we're going to convince the general public that it is in their best interest to see the doctors and the junior doctors and the GPs and everyone working under the NHS to receive such a significant pay rise. And I think that's where the deadlock starts to come in with the NHS strikes and what's happening right now.
It's important to like note that the NHS strikes in particular are some of the strikes that have the most public support, and that's that's partly because people don't use the NHS every day, so they're not going to be they're not going to be affected by it as much, and also just the amount of attention that the NHS does get in the media is a lot, I think, in normal times compared to some other professions, because there's always questions on how it's going to be funded, and especially around the pay issue that has really sunk into the public consciousness. And then surrounding the pay issue is just the further issue of vacancies and employment in the NHS as well, because there's always talk about bringing more foreign workers in to fill the NHS, but then both parties want to increase domestic employment in the NHS as well, which to get that balance right is something that I don't think either party has really figured out.
Yeah, I think I'm not a big fan of Wes Streeting in health. I just don't think just in terms from a Labour perspective, I don't think he particularly understands the NHS as much as someone like Rosina Allen-Khan, because he was talking about like scrapping GPs as a whole, when GPs are doing so much vital work and they're not paid particularly well compared to some other doctors, and they're one of the professions that are missing the most. So I agree that I don't think either party's got it quite right yet. I do think we're in a sort of similar position to when Tony Blair came into office, because the NHS is just at a place, it's a breaking point, as I was saying, and it needs a Labour government, I'd say, to fix it, because I think at least Labour are going to give it more money and have the kind of support to give it more money from the public. And it's going to cost a lot of money. Solving the NHS crisis is going to cost a lot of money because of what David Cameron did after the financial crash, because that was such a costly mistake in the long term. In the short term, it was we need to balance the public finances. But in the long term, it's so expensive, because you think about how many doctors are leaving the profession each year, and you think about how many are being recruited, and we've just not been recruiting doctors at a level that we needed to. And when that happens, you have vacancies everywhere, and you have more doctors that are then covering more shifts. That's more stress. And you've got this cycle that it builds up and builds up so much, because a little bit of money taken away has a massive impact, because then you have to double it the next year. Because you're always going to have to increase NHS spending with inflation, and we have an aging population, and we've gone through a pandemic. And it's going to cost a lot of money, I think, is the simple point. But it is well worth paying that money, because there are so many people that rely on the NHS. And you look at somewhere like America, that's not a situation that we want to be in. Instead, we're going to have to spend money on the NHS, and we're going to have to get it back to where it was before. And then we can start to work on things that people have talked about, like proactive care and things like that are futuristic. And I think that's important, but we're not even at a stage where we can be discussing that. People in the NHS are still using antiquated technology from 10 years ago, which is nowhere near what it needs to be.
Right, and I think Wes Streeting's response about nationalising GPs is just symptomatic of the larger issue that politicians really have very limited understanding about how they're going to deal with the NHS and how they're going to deal with the crisis that we're currently in. And I think one of the key issues that unfortunately the Conservative Party got themselves in a place where they've developed a very hostile relationship with the public sector at a point in time where we need to be nurturing, working alongside our doctors, our train drivers, our railway workers. And you see that, I think, in Steve Barclay and his almost, here and go kind of reluctance to negotiate with the NHS, the Royal College of Nursing. And that's really an issue. So I think the only way I can see perhaps a progression out of the crisis that we're currently in is bringing in that corporatism from the 1960s that we saw, where we saw, particularly the Labour government working closely alongside with unions. I don't think this hostile approach and the you versus them argument worked like it did in 1989, because as Piers said, they've received the NHS has kind of received a lot of public support. So I think what Rishi Sunak needs to be doing is thinking of a conciliatory approach going forward, rather than an approach where he's trying to combat the strivers against the scroungers or whatever, because it doesn't really seem to be sticking anymore.
I mean, the sort of the stuff that Steve Barclay was saying was ridiculous, really. If you look, he was saying NHS staff need to work harder to earn their pay rise, and I mean that stuff does not wash at all. Looking at the state of the NHS, it's his government's fault that we're in this situation in the first place. I don't think that the percentage that they've asked for is realistic, but I think it's a bargaining strategy. They know it's not a realistic pay, like it's not realistic to ask for a 19% pay rise, but an inflation level pay rise I think is completely fair. And as I said, it would only cost around £10 billion, which in the context of the Tory mismanagement is absolutely nothing.
There's also the often well it often takes a backseat to the more like main NHS discussions, but social care and things around mental health always takes a backseat to the main NHS. And you know, in the 2019 manifesto, there was a lot promised in that field, and that's sort of just disappeared by now as it goes in and out of media cycles. And well, I mean I mean, it's inevitable that that's going to be something that takes up more and more of the government's time, as you know, there's more and more awareness about that thing. But right now, I just don't think it's in there enough.
Yeah.
What I think is a really interesting argument, I think, is I was listening to, it must have been a podcast about the universality of the NHS and whether because obviously when it was founded on the idea that everyone, you know, from cradle to grave receives welfare regardless of who you are. And I thought it was a really interesting argument. I can't remember who put it forward, but it was a suggestion that if you earn a certain income, you should not be allowed to use the NHS, or some services should be limited. And I think the idea was it would combat the, you know, endless waiting lists and the backlog and again, we'd be able to preserve service for people that really need it. I thought it was an interesting argument, and I'd like to see what people thought about that, because I was struggling to think if that was a plausible solution.
I'm not sure I could I'm not sure I could buy it. I mean, again, where would you even draw that line? I guess is another thing, because there's this in between area where it's like, well, I probably could afford private healthcare, but that would then put a strain on my budget, and I think it's a tough argument to make because everybody's paying taxes toward the NHS, therefore everyone should get to
That's
use
true.
the NHS. I think if you're willing to use private care, I mean, I don't have a problem with that, and I think it's useful when some people are using private care. And I mean, I'd touch on what Rishi Sunak was getting in a bit of trouble for earlier this week when he wouldn't admit if he was using private.
Oh my god.
If he uses private healthcare, why does he not go and say, "Yes, I'm using private healthcare because the NHS is in such a crisis"? I mean, he's not even willing to admit that the NHS is in crisis, which is the first problem that we've got to deal with.
Crisis? What crisis?
Yeah, exactly. It's like because that would mean that they'd have to admit to their failures, which they're
Yeah.
very
Right.
not they're not best pleased with happening. But he'd be much better saying, I think, and yes, I use private healthcare because the NHS is in such a state right now that I'm trying to preserve its resources for other people, and I think that would wash a lot better. It's interesting that Piers mentioned the social care point. Social care is, I mean, it's a mess, and so the NHS is to an extent as well because they're so bureaucratic and they're so big that it's very. I think it's tough to sort out social care. Not to give Boris Johnson any leeway because he did promise to fix social care, which he most definitely hasn't done. But it's a tough political problem, and it requires political capital to solve, which Boris Johnson didn't have at the end of his tenure, and it's such a tough problem to solve. I think we can solve it, but it's going to take a lot of effort in government and a lot of civil servants and a lot of people who actually work in social care, and also just paying. I mean, the start is paying people in social care more because the amount of pay that people that are working in social care get it's ridiculous.
Right. So it seems that the key kind of bullet is obviously extra funding for the NHS.
Mm.
But I think what the real point of contention is how we fund that. Because I always think, you know, just thinking in the eyes of the electorate, does it make sense that they should have to, ordinary working people should have to pay extra taxes for a problem that was essentially entrenched by 12 years of a Conservative government? So I think if we're going about reforming the NHS, obviously funding is one of them, but I think what politicians need to do is perhaps think of an alternative argument to, well, we're going to just increase taxation, even though, you know, I'm not adverse to increasing taxation, but particularly in this cost of living crisis, in this political climate, I think it would be useful for wedge streeting, Steve Barclay, whatever's going on, then to think of a solution that doesn't involve kind of angering a lot of ordinary working people.
Yeah. I mean, it's a tough issue, I think. It really is. Where do you get that money from? I'm just so frustrated with the past Conservative governments who've wasted so much money on things like PPE that doesn't work and things like a test and trace service that was used for a very little amount of time. There's so much waste within government that all could have gone to the NHS. And if they had a proper plan in place, which involved an actual workforce plan and it involved more funding for areas that need it, and actually having a plan in place that would use that money correctly, because that's the other thing. Governments often just throw money at the problem sometimes, which helps to a certain degree, but if you don't have a plan and you don't have if you don't have an objective and you don't have targets, it doesn't work. I mean, we gotta finish off now, but I think that's an interesting place to end it in. I mean, how do we pay for this? It's not an easy answer, that's for sure. Thank you to you for watching the video. Thank you to Piers and Danielle for coming along. Like the video, subscribe, and we'll see you soon.